So the last thing I want to discuss, which I hope is helpful, is to when you're looking at one of your patients and you're trying to improve your goals of oxygenation and ventilation, what's a simple guide to what you can do at the bedside? So if we consider a normal venous blood gas, pH range, CO2, O2, O2 sat, this is our mixed venous sat again, our level of bicarb and our base excess, and then we consider the graphical representation of ventilation in a patient, then we can make some adjustments to help bring these values in to more normal ranges. So when you look at a graphical representation of a vented patient, you see a graph with pressure on one side and time on the other. Your lower number is going to be your PEEP, or where your FRC is, your minimal distending number of amount of pressure, and your top number is going to be your PIP, or your peak inspiratory pressure. The area under the curve represents your volume, and this is the time of inhalation as well as exhalation. The PICU attendings go over vented patients extremely well, so I'm just keeping this very brief. So if you want to improve your ventilation, we know the most important thing to improve is what's called your minute ventilation. And the two factors of your minute ventilation are most simply going to be your respiratory rate and your tidal volume. So if you want to decrease your PaCO2, which improves your ventilation, you can increase your respiratory rate, or you can increase your tidal volume. This makes sense because by increasing your rate, you're going to increase the area under the curve, as well as increasing the volume, the size of the curve. So by that, we know we can also alter, if we're talking about altering our volume, we can alter our pressure. So you can do that by either changing your delta P, increasing it, the difference between your peak and your your expiratory pressure, and you can also simply change your PIP, or your peak inspiratory pressure. Essentially what this is doing is it's increasing your area under the curve. You can also increase your I time in most cases. In order to improve your oxygenation, increasing your oxygenation, partial pressure in your arterial blood, the most simple that you can do is you can, of course, add more inspired FiO2. Otherwise, in terms of increasing the area under the curve, we can increase our pressure. The other thing that we can do is we can increase our PEEP, which will shift the whole curve up and have a bigger area under the curve. All of these strategies, of course, are going to be dictated by the pathology in your patient's lungs. Some lungs that may be acting like West Zone 3 type lungs with pulmonary edema, where there's more than adequate perfusion but poor ventilation, would benefit most likely from increasing PEEP. Recruit those lungs and increase the amount of volume in the lung. And again, mostly what we're doing is increasing the mathematical area under the curve. Also, of course, by increasing your minute ventilation with better ventilation, we do know we're also going to get an effect on our oxygenation. And we can also, of course, manipulate our time or our I time. These, however, are going to be your three that are most accessible for improving oxygenation, and these will be your main go-tos for improving your ventilation. I hope that was helpful. Thank you very much.